All right, thanks so much. Well, get this, there's a new weight loss procedure that requires no knives or a long recovery time.
It's called endoscopic sleeve gastroplasty. Did I get that right?
Long word.
Long words, yeah, especially for me. Here to tell us more about it, Dr. Garrett Peel with the Previty Clinic. Good morning. Now, how is this procedure different from some of the others that we've seen?
So this procedure is done through the mouth.
What?
Yes.
Through the mouth?
Through the mouth.
They tape your mouth shut and it does a lot of weight.
Duct
right?
tape? Yeah, that's what I
So
mean.
we know that obesity is a disease, and we know that we can cure obesity and all of the other medical problems that come along with it if we can get our patients' weight down, say 50, 60, 70% of what they need to lose. Now, there are lots of tools to do this. Sleeve gastrectomy, gastric bypass, banding. The newest from the Mayo Clinic is called gastroplasty. And what it does is it simulates or replicates what we do with a sleeve gastrectomy.
Okay.
So remember, we've talked about the sleeve gastrectomy before. We create a little tube of stomach, so it's restrictive, and that tube is like the size of a banana, right? So it limits how much food you can eat.
Exactly.
And then we basically let the patient eat a meal that is much less. Okay, and so with that comes a way to lose weight pretty quickly. The gastroplasty creates the sleeve without cutting the stomach out with sutures.
That is very appealing to people,
and it creates that same banana kind of sleeve, but instead of having to go to surgery and make an incision on your abdomen, we use this special device called a helix device. It goes through the mouth. So in essence, we're not banding, we are plicating, okay, the stomach so that it creates that small tube and prevents the amount of food you can eat.
So you have like a camera that goes down with it to see where to place it?
It's actually used on the end of a scope. You've heard of colonoscopy and EGD. All of that is the same concept, but we're using those specialized instruments on the end of a scope.
And they're pretty small, so I mean, don't think you're gonna, you know,
they're very small. Yeah. This procedure takes about 2 hours to do. It's a long procedure. It's just approved right out of the Mayo Clinic. In fact, when I trained there, I saw this procedure in some of the research studies and participated in some of that. And it is a fascinating frontier. That said, it's not for everybody. But what is for everyone is if you need to lose weight, if you talk to your primary care doctor and you have a BMI of 35 or greater, or if you have other medical problems that are associated with being overweight and obesity.
Sleep apnea, stuff like that.
Absolutely. All of those diseases are targets for surgery, for weight loss surgery.
So how do you determine then who's right for this procedure? You say it's not for everybody, so people are just saying, can I get it?
Because it's still somewhat in the research phase, the criteria are very strict. And it would be best probably to ask the Mayo Clinic. However,
so have you performed it yet here?
I have not performed it here, but it is something that we can do. And will do eventually. Again, as innovation changes, we want to, bring the most innovative surgery possible to Southeast Texas, and this is one of them. And it really is a remarkable thing because some patients who are not candidates for surgery are candidates for this. And again,
do you do general anesthesia still?
This requires general anesthesia, and it requires a lot of follow-up. All right, and so the results are wonderful though. Patients are losing 60, 70% of their weight.
That's great.
We see a little better results in the sleeve gastrectomy, but again, the data are so young. And so the bottom line is that if you're overweight and you have obesity, we can cure your obesity with surgery, whether it be a sleeve gastrectomy or this new innovative gastroplasty. Seek attention from your primary care doctor.
Absolutely.
The battle of the bulge doesn't have to be yours for life.
Yeah, definitely. What is the bounce back time from this? Is it quicker than the...
Yes, it is, because they're not small incisions throughout your tummy. This basic patients usually go home on day 2.
Oh, wow.
Yeah.
Would it be less expensive as well, since it doesn't involve?
It is less expensive. It is. It's about $5,000 to $7,000 less expensive, but more expensive for the hospital because it's a new innovation. So all of that battles out. But just a handful of doctors throughout the country are being trained on this right now, and it is very exciting, and we hope to bring this technology to Beaumont.
Fabulous.
Can't wait.
Yeah, right
absolutely.
on the forefront of it all.
Talk to your doctor first, though, as always.